Hi, my name is Steve Cramer, and I'm going to talk to you today about stroke and the brain. This is the human brain. It's the only organ in the human body where if you put McDonald's or Dairy Queen or Pizza Hut in on one side, out comes on the other side the Mona Lisa, a Bach violin partita, or the US Constitution. If you put the kidney in the middle there, different things come out at the end. Let's just review the human brain together, shall we? There's usually one brain per person. Sometimes it seems a little less in traffic, and weighs about 2.5 pounds per person. It's about a half a cup of spinal fluid on the inside and outside. So it's a hollow toroid filled with fluid in the middle and fluid on the outside. And that's where the brain floats. So when you turn your head real fast, it doesn't bunk into the bones. There's about 100 billion, 80 to 100 billion nerve cells in each human brain, each of which has 25 helper cells, right? And these nerve cells, just like in the movies, have about 6 degrees of separation from the other 100 billion nerve cells, thousands of connections for each cell. There's about 100,000 miles of wire, axons, which are the nerve cell outreach wire, about 100,000 miles of wire in each one of our skulls, conducting at about 200 miles per hour. The brain uses 20% of the body's blood flow and energy. So even though it's only 2% of the weight, it burns 20% of the calories. So it's sort of like the United States of the body's organs. And that blood is delivered to the brain. 20% of the heart's output is delivered to the brain through 400 miles of pipes inside each one of our skulls. And you only need blockage of one of those pipes to get a stroke. So let's talk about that a little bit more now. So what is a stroke and what is a TIA? A stroke is an event that happens that causes the blood flow to be interrupted and nerve cells die because they don't get their blood flow. Why do nerve cells need blood flow? Nerve cells, as we've said, are very busy metabolic machines. They're factories that are working day and night, constantly burning fuel, right? They've got to burn fuel in order to keep the cell at a certain degree of negative voltage. And that's how they do their job. So nerve cells are constantly burning fuel, and they can get the fuel from lots of places, but to burn the fuel, they need oxygen. So blood flow, blood is mostly red blood cells. There are hundreds of red blood cells for every one white blood cell. And red blood cells are just bags of hemoglobin. And hemoglobin is just Velcro for oxygen. So when the blood flow gets interrupted, the nerve cells don't get their oxygen and they can't burn their fuel. And when that happens, that's a stroke. About 85% of strokes are because the pipe carrying the blood with the red cells and the hemoglobin, that pipe gets blocked. And that's called an ischemic stroke, ischem, because there's no heme, no blood flow. About 15% of strokes are hemorrhagic strokes, where the pipe actually cracks open instead of simply blocking. And now the blood doesn't get to the nerve cells, but is spilling all over the place. So a stroke is interruption of the delivery of blood flow, and nerve cells die because they don't get their oxygen. A TIA, that stands for transient ischemic attack. That's when a stroke hits, but then it breaks up before it becomes permanent. The technical definition of a TIA is that it hits like a stroke and goes away in less than 24 hours. But most TIAs only last maybe 30 or 60 minutes, okay? And so here's the arteries. And so the carotid arteries, we have 2 in the front, and the vertebral arteries, we have 2 in the back, and then they branch and they branch and they branch. And it's blockage of one of these arteries or one of the branches, or tearing open of one of these arteries that causes a stroke, that causes the nerve cells to die from lack of oxygen delivery. Stroke is common. There are 795,000 new strokes each year that cause symptoms. And people think there's probably 3 or 4 silent strokes for every symptomatic one. So the actual number may be much higher. It's the 5th largest cause of death in the US, causing 1 in 17 deaths, and the 2nd leading cause of death in the world. Year after year, sadly, stroke remains the leading or one of the leading causes of disability. The annual cost in the US is estimated to be in the 60, 70 billion, and that was years ago. And the mean survival after a stroke is 6 to 7 years. People have their stroke typically in their 60s or 70s, and then they live many years thereafter, almost reaching the normal lifespan. So whatever happens with the stroke can affect the person and their social circle and many around them for many years to come. Again, a stroke happens when the nerve cells can't burn their fuel. So if you're a nerve cell, you like to burn glucose, which we get from our diets. If you're a candle, you're burning cow fat. If you're a Cadillac, you're burning gasoline in your tank. And the way it works on Earth is you have that fuel, whether it's glucose in the blood, cow fat in the candle, or gasoline in the tank, and you burn it in the presence of oxygen, and that produces the energy you need and carbon dioxide and water. And if you don't get the oxygen, you can't burn the fuel. And that's what happens to nerve cells during a stroke. So this is what a stroke would look like. This is a left middle cerebral artery occlusion. This is a big stroke. And then normally the blood in this angiogram, the dye is injected in the artery and fills out where all the arteries are here. And the dye stops here because this artery is occluded. And so all of this area would normally have some black dye in it as well. But because of the blockage, it's not getting it. This is an area of the brain where the nerve cells are not getting their blood flow. And without the oxygen delivery, those nerve cells are going to die rapidly. This is how it would look. This is the parts of the brain that would go away if they don't get that artery unblocked. And if you did an MRI scan after that stroke happened, you would see a large area of the brain turn white on this diffusion weighted image, which is consistent with nerve cells that did not get their blood flow and are dying or are already dead. Fortunately, there are acute stroke reperfusion therapies. And what that means is if you can get to somebody in the early hours after a stroke and get them to the right stroke center, they can give an intravenous injection or put a catheter up there, invasion of the clot snatchers, and pull the clot out. So either intravenous drugs such as tissue plasminogen activator, TPA, or catheter-based techniques, pulling out the clot, can hopefully open up the pipe before too many brain cells die and improve the person's outcome compared to not having that acute reperfusion therapy. And so for that reason, stroke centers are becoming more organized, are proliferating, and acute stroke therapies are leading the way to improve outcomes after stroke. These acute stroke therapies are complemented by repair therapies, which pick up where the person's injury is fixed, whether it was treated or not, whatever the injury in the brain is, and the smoke has cleared. Now we say, what can we do with the injured brain to massage it and treat it and get it to go function as close to pre-stroke as possible? And that will be the topic of another talk. Thank you for your attention.